Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will do another one important topic, which is mastering communication. Communication station is very important in the exam. First we'll do introduction. Communication station is the easiest station in the exam if you know what you have to do. You have to read the scenario carefully, at least twice, and you have to understand what is your task exactly. You will be given a white paper with a pencil. You will write the name of the patient, you will write your role, you will write the task, what about. In this station you are the friend of the patient, so try to be sympathetic, empathetic and helpful to the patient. You have to listen more, talk less, and when you talk, always check the patient understanding and concentration with you. Are you following me? Are you with me, Mr. X? Remember, in this station, the examiner judge your communication skill, not knowledge. So be fluent. Do not repeat same sentences. Don't forget eye contact. Do not interrupt the patient and never overlook or ignore his concern. Every scenario consists of introduction, body or content, and closure. Introduction and closure mostly the same, and the content different according to the scenario. Let's start by the introduction. There is important 6 topic. First, introduce yourself to the patient. Hello, my name is Dr. Talat, one of the doctor in the facility today. Then confirm the patient identity by 2 identifier. May I confirm that I am talking to Mr. X, 50 years old? Then confirm meeting of the agenda and take permission from the patient. Today you are here to discuss some issues related to your health condition. Is it okay with you? In case of breaking bad news, as the patient, ask the patient if he want anyone else to attend with him for support. Explore how much the patient know about his medical condition to be in the same page. Or before we proceed further, can you tell me how much do you know about your medical condition? To check the patient idea, concern and expectation. Mostly he will tell you and finish his words with concern. Let's take one by one. For example, the body of breaking bad news and counseling of new disease. You have to deliver the information gradually and allow the patient to digest it. Example, Mr. X, the imaging of you is with me now, and I'm sorry to say it's not as good as we hope. Then stay for seconds. It's a golden silence. Let the patient digest. He will mention, what happened, doctor? This imaging shows that you have a disease called cancer, for example. And wait some second. Show empathy and empathy for this patient. Be sure that we are here to helping you, and ask about, do you hear about that? Do you want me to explain more about it? If he told you, okay, explain. So it will be in counseling about new disease, or sometimes come as a counseling of new disease alone. So the best is if you can draw, because you will save some time, and this will be helpful in explaining the anatomy and the pathophysiology. Then to C and to M, cause, complication, manifestation and management plan. Management plan will be divided in 2 points. You will admit the patient or no, and who is the treating team. This is a group of specialized doctor in the form of chest doctor, lung doctor, blood doctor, and according your scenario. If your scenario cancer, Macmillan nurse should be one of the treating team. The body of explaining procedure. There is 2 parts. Why we need it and how we will do it. Why we need it? Explain it. For example, we need to do this procedure, renal biopsy, to confirm the diagnosis, to know the staging of the disease, because every disease has different treatment, and explain like this. How? Before, during, after. Before, you will come to the hospital, be sure that you are fit for surgery. If you are on blood thinning medication, we will stop it, and so on. During, explain the procedure. For example, you will be in the hospital in private room. We will lie on your tummy. We will numb your back and insert a needle and explain how the procedure will be done. After that, you will stay in the hospital for some time to be sure that you are fit for discharge, and highlight complication of any procedure to be 2I and F: pain, bleeding, infection, injury, and failure. And explain also these are the complication of any procedure, red flag, and return back to the hospital if any, and never ever forget the consent. Any procedure you have to ask for consent. It will be written consent. It will be contain what we are discussing in our meeting today. Take your time and read it carefully, and when you are ready, sign it, and you have the right to withdraw at any time before the procedure. Body of medical error, one of the simplest scenario. Most the patient will be angry or his relative. Try to absorb his anger. Duty of candor, honesty, transparency to the patient, explain to him what happened exactly. And rule of A, 3A, admit that this is a mistake, apologize on behalf of your team. Actions, incident report has been written, seniors, charge nurse, consultant had been informed, root cause analysis to investigate why, how, and when it happened, and morbidity and mortality meeting for follow up your, if you want to ask for complaint and follow up the incident report, and risk management team, which is used to prevent this mistake from happening again, and to update our policy in the hospital. The body of refusal, any refusal, for example, patient refuse admission, refuse discharge, refuse to start medication. May I know why? You have to explore why. Try to give him solution. If he, for example, don't want to be discharged because no one will care him there, you will involve social work like this, and explain also the seriousness of the condition. If you stay, there will be a lot of hospital acquired infection, depression, and so on. If he refuse to start the medication, explain why, and there's a seriousness of why you don't want to start a new medication, and explain the seriousness of the disease if he did not start the medication. The patient insist, involve your consultant, avoid confrontation. The body of side effect of medication, you will explain the disease, explain the benefit of medication, and we give it. And what if we did not give the medication? Then highlight the disadvantage and enumerate the side effect. And usually, if you give negative information or negative idea followed by positive idea, you give him now disadvantage and side effect, this will be less by control dose and regular follow-up, or we will give you the minimum dose that used to control the disease and does not cause a serious side effect. The body of non-compliance of medication, always non-compliance. May I know why? Try to find a reason and give solution. If the patient forget, give reminder. If the patient for example, a lot of tablet, try to give some tablet are mixed in one tablet, and so on. And also highlight the complication of the disease due to non-compliance. If the patient insists, involve your consultant. In the exam, the scenario will be longer because the patient will negotiate with you. He will raise some concern inside the scenario. Then needlestick injury, for example, patient came to you. Mostly it will be one staff came to you with HIV, needlestick injury with patient known to be HIV. You have to understand what happened exactly before, during, and after. Before injury, she was wearing gloves. How many gloves? During, did she or he see the blood by himself? What about the cannula? It was white bore needle or no? After, did he wash it? Did he squeeze it? And ask about vaccination, and try to reassure, because the patient will be afraid. Try to reassure. Rule of 3, Hep C, risk of transmission 30, Hep B 30%, Hep C 3%, HIV 0.3%, and right incident report should be written. Did he receive vaccination for hepatitis B or no? If he is not immune, he should receive hepatitis B vaccine and hepatitis B immunoglobulin if the patient proven to be hepatitis B. If not, only hepatitis B vaccine, the 3 doses. Verbal consent for the test and confidentiality, very important. Explain to the patient this result will be confidentially delivered to him by hand, not by telephone or by email. And the precautions until the result: safe sex, not sharing needles, not sharing any instrument with his friend, reallocate him if he's in a job contact with patient as office work until the result came. And no donation for sure. End of life care and palliative. End of life care for patients who are expected to die soon, while palliative for patients with advanced disease with no hope of cure and not known exactly when they will die. 4 questions: why, how, where, and by who. Why end of life care or palliative? 2, we are treating the symptom rather than the disease to keep the patient as much as comfortable as we can. How? Before plan of care, you have to discuss advanced directive, living will and lasting power of attorney. We want to decide for a plan of care for your father, for example. Does he nominate anyone to take decision in case of he unable to do so, or does he has any document that tell what he want to be deal if in this such situation when he cannot take decision, and so on. This is before. During by 2B, 2S. 2B physical, psychological, 2S social, spiritual support, where it can be done in hospital, in hospice, even at home. By who? By the team according to your scenario. End of life team, end of life care team, or palliative team. Macmillan nurse if there is cancer. DNR, do not resuscitate towards irreversible damage of the brain. Equally, your father or your mother is technically dead. You have to explain the advanced condition to the one you are talking to according to the scenario. Okay, and the decision is the treat or is not do not resuscitate is the treating team decision for the best interest of your father to avoid a complication, and highlight the complication of resuscitation after explaining how resuscitation is done, and highlight the chance of coming back after. If resuscitation happen, it will be very minimal because he's with irreversible damage of his brain, and if it happen, it will be a very bad quality of life, and to maintaining his dignity and not to adding suffering to his suffering, the treating team decided not resuscitate for him if his heart stopped. Start new medication. 2 questions: why and how. Explain the patient the disease and highlight the complication if not treated, so why we need to give the medication. And for any new medication, how, dose duration, route, oral or syrup or IV or accordingly, and also highlight the side effect and how to avoid. As we mentioned before, we will tell benefit outweighs the risk, and usually controlled dose, regular follow-up will be the saving for you. Complication of procedure: explain what happened to the patient exactly, honestly, not a medical error. No need to apologize, just only sympathy. I am sorry for what happened to your father. I am sorry this condition went through this way. It's a documented complication, and the patient is informed about the complication, and he has already signed a consent, and follow with the patient according to what he will raise concern. Closure. Okay, closure mostly the same. When you hear 2 minutes remaining, you can do quick recap, summarize, or check patient understanding. If you can manage this within 1 minute, no summarize if your case breaking bad news or angry patient, or no checking understanding also if your case breaking bad news or angry patient. Ask the patient any other concern. If he asked the concern, answer him. If no, so offer leaflet, brochure, website to read more about your condition, and the number of our department. If you have any inquiry, contact us at any time. I want to highlight some important point. Hidden agenda: this will be raised either by you or by the patient. By the patient according to to the scenario, so be ready for any surprise or gift from the patient. By you, in case of your scenario, patient is female, raise the issue of pregnancy. In case of condition risky to the patient or the others, reallocate him a new job. For example, Hokam and he's a pilot, pneumothorax who is doing scuba diving and so on. He's diver. On driving, in case if you have to ask him to inform DVLA and stop driving, TIA, stroke, epilepsy, Hokam, any vision affection. Rule of communication, there is some rules of communication. Never overlook the patient concern. Never ever give a false hope. Never give a false information. Never give a specific time for anything unless it is written in your scenario. Never pressure on the patient to be convinced. Avoid confrontation with the patient. Involve your consultant here. Follow your task. Stick with your task. Do not invent anything not written in your scenario. Trust the scenario and trust your consultant. Concern. Doctor, please concentrate with me. You are here to answer the patient concern. Your job, your task, answering patient concern. There is a skill called concern, pass mark 10 out of 16. So, one unsatisfactory, one borderline, you will be at a very high risk to fail the skill and fail the exam. So, never overlook, never ignore the patient concern. There is a lot of concern you will understand and memorize by practice. Most concern with fixed answer. So my advice to you, try to collect them in one PDF and keep them in your mind and memorize them and keep them as if you are saving your name. Activate the maximum etiquette and politeness with the patient. You will get welfare here, because welfare here in communication skill will be by emotional discomfort. If you affect emotional discomfort, skill will be affected. Any negative idea should be followed by positive idea. Any bad news should be followed by sympathy and empathy. I gave you some examples of the concern. Doctor, is it treatable? I highly appreciate your concern. I am sorry to say it's not treatable, but controllable by compliance with medication and regular follow-up. Is it cancer, doctor? I highly appreciate your concern. I am afraid to say yes, it's cancer, but be sure that we are here to help you and give you the maximum support. Will he die, doctor? I highly appreciate your concern. I am afraid to say this disease will shorten his life, but be sure we will give him the maximum support to help him through his journey. Is there any hope, doctor? I highly appreciate your concern. I am sorry to tell you this condition is very advanced. However, we are going to give you the full social, psychological, medical support to keep him free all the time. Okay, so we finish our communication. Still two topic, neuro and abdomen. Inshallah, I will try to finish. Be prepared well. One scenario per day I think is enough. If you have time, 2 scenario for practicing different types of the communication. 32 mark, I think at least 28 up to 32 should be in your hand. Assalamu alaikum. Shukran. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.